742, talking about your money right now, and what will success look like under this? Well, we don't. It's nothing normal about it, but it is kind of a new normal here with COVID-19. Joining us this morning, talk a little bit more about that is Stewart Welch from the Welch Group. Stewart, good to see you this morning.
Morning, Mike. How you doing?
Doing well. And, we know a lot of businesses right now are not doing well. They're starting to try to jump back into things, being allowed to reopen, a lot, obviously with some safety guidelines in mind. But it's a difficult situation. I'm sure you hear from clients all the time about this.
We do. And I think everybody's talking about the health risk around COVID, but very few people are talking about the financial risk. And the financial risks are really out there. So if you catch COVID, or a family member catches COVID, it's going to cost you money. It's going to cost you potentially time away from work. If your work involves some kind of incentives like commission, you're going to have those at risk. And if you end up in a hospital stay, I just read an article that the average hospital stay for COVID cost about $30,000. And depending on how good your health insurance coverage is, you're going to end up paying part of that. And if you end up on like a ventilator, if you end up in ICU, those costs are in the hundreds of thousands of dollars. So there's some real risks there. And as you know, I'm all about mitigating risk. And Mike, the example I like to use is the chance of you being in an auto accident today or even this year is very small. But still, every time you get in the car, you buckle up. And it's one of the ways you mitigate risk from a serious injury to a car accident. And this is the same thing. So there are 4 things that we can do, easy, common sense things that we can do to mitigate the risk or reduce the risk of us contracting the COVID-19. And the first one is to maintain social distancing. And I've noticed a lot of young people act like this crisis is over, and that's a big mistake. The second one is to wear face covering, particularly when you're in public areas, but particularly when you're in buildings like a grocery store, where it can be pretty difficult, if not impossible, to maintain that social distancing all the time. And then the third one is to practice what I call extreme personal hygiene. It's before you enter a public space, wash your hands, sanitize your hands, and then after you leave, sanitize your hands. And Mike, we all need to retrain ourselves not to touch our face, because that's how we're contracting this virus.
Yeah. And and for folks who don't know, you're also the mayor of Mountain Brook. Obviously, restaurants are allowed to reopen if they can right now with the 50% capacity. Have you talked to some restaurant owners there? How are they doing so far with that? What are some of the challenges still facing them?
Well, I think the fourth thing that you can do, and this is more about helping the community, is by practicing the first 3, your chance of contracting and then passing on that virus is minimized. But we really need to support our local businesses. These are people that most of the business owners live in Birmingham, in and around Birmingham, and all of the employees live in and around Birmingham. And this is a real critical time for them. They are all suffering. They're all struggling to make these businesses survive through this. It is our job to help them. We do that by making sure that we are shopping local. And if you're shopping online, shop online local. And I think if we do these 4 things, we can create success around this really horrid disease.
All right, yeah, so certainly if you have the means, definitely support those establishments. All right, thank you very much, Stewart. Look forward to talking to you next Tuesday.